do an expose, do a holistic expose on ulcerative colitis. What is ulcerative colitis? One thing we must understand is that this particular medical condition affects your large intestine. It affects your large intestine. And what happens there? When we begin to see inflammation starting from the anus, for instance, and then climbing up the descending colon, then you know something is wrong. You just know that something is wrong. So ulcerative colitis is a lifelong condition that causes what? Inflammation and ulcers inside your colon. And when we mean colon here, we are referring to your large intestine. We have the small intestine. We equally have the large intestine. It's one of the most commonest inflammatory bowel disease that medical personnel know, alongside another disease we refer to as Crohn's disease. So as a matter of fact, ulcerative colitis, as the name suggests, is like having ulcers inside your large intestine. So imagine this kind of condition will definitely make anybody comfortable.
Super root coughing.
Please, there's somebody talking there. I'll appreciate it if the co-host can mute the person. So there's no way you can be having ulcers around your large intestine and you are still comfortable. So today's topic will really expose what this condition is and enable us as participants to be more aware. Called Say Super Life Nigeria. So you can see how educative our programs have been each week, week in, week out, called Say Super Life Nigeria. So there is need for us to truly appreciate this company. Now let's look at some of the types of ulcerative colitis that we will be covering in today's topic. Number one, we will be looking at ulcerative proctitis. That's number one. We're going to look at proctosigmoiditis. We're going to look at distal colitis, extensive colitis, and pancolitis. So today's presentation is going to cover these five. There are more like the fulminant ulcerative colitis, which is very rare, but very severe when it attacks an individual. So we will be looking at all of this. Let me take them again. Ulcerative proctitis. We're going to see what it means later. Then we'll look at proctosigmoiditis. That's number two. Number three, distal colitis. Number four, extensive colitis. And number five, pancolitis. So we should cover these five if time permits us. So let's just go straight and look at what can cause ulcerative colitis. As a matter of fact, as medical personnel, we've looked at autoimmunity as the number one culprit, in addition to so many other things we will be talking about later. But the major number one culprit is autoimmunity. On so many occasions, Dr. Chooks have taken the pains to explain to us in this gathering what autoimmunity means. In case you have forgotten, autoimmunity means when your body begins to attack itself. What it means, if I'm to break it further down, is as human beings, we have normal, healthy cells. For reasons unknown, we now find some of these healthy cells now behaving in an abnormal manner, where they begin to attack other health cells. So where you now have cells in a particular area now attacking other cells. So you now find the body fighting against itself. It is the negative side of immunity. For those who have received lecture under immunology, they are quite conversant with this particular topic. It is a major topic under immunology. So, but here we are not doing a lecture on immunology. So please just take that little explanation. We do see it in the medical world where your body cells begin to fight itself, and that is quite dangerous. So around that region, in addition to so many other factors like genetics, race and ethnicity, your age, and the type of microorganisms that are found within that region, all of them can play a major role in determining uh, the presence of ulcerative colitis. Now let's look at the prevalence, the global and Nigerian prevalence of ulcerative colitis, UC. As a matter of fact, this disease is quite alarming, especially in the western part of our globe. It is a disease that is so prevalent in the region. Please, somebody should meet that lady. Then it is estimated that over 5 million people are carrying this disease globally. And the high prevalence area in Europe and North America are countries like UK, Denmark, and Norway. These countries have very, very high prevalence. Most of these Scandinavian countries. If you know, for those who are conversant with geography, the Scandinavian countries are countries like Denmark, Norway, Sweden, and Finland. These countries are referred to as Scandinavian countries. So the prevalence of UC, that's ulcerative colitis, is quite alarming in these European nations. We equally find high cases in North America as well. Most of those northern blocks, European northern blocks, tend to have more ulcerative colitis. The prevalence in Africa tends to be mild, probably as a result of our diet. If you come down to Nigeria, the prevalence reported is just around 1.3%. So you might say that ulcerative colitis in Nigeria is quite low. But because our people, Nigerians, are beginning to imbibe foreign diet, foreign form of dieting, we are beginning to see an increased surge of ulcerative colitis, where you now have modern children departing from our conventional meal, like ofe olugbo, ofe nsala, and the rest. And you see them eating something they consider too modern. They leave all the sweet vegetables we have in Africa, in Western Nigeria, and Northern Nigeria, Eastern Nigeria, and you see them taking all these canned foods. Because they are more exposed now to canned foods, people are now beginning to record incidents of ulcerative colitis. And the reason why the report is still indicating a low percent is just because of underdiagnosis. A lot of people do not know that there's need for diagnosis to be done on a condition like this. So there's this underreporting as a result of underdiagnosis. So, but this lecture is going to us handy called See Super Life Nigeria through the Revolution Project led by our able high chief, the king himself, Chief Unaman. So we should be appreciative. Please, before I forget, I want to appreciate somebody, an anonymous sender who sent me a recharge card. The person refused to indicate his name or her name. I just want to use this opportunity to say thank you to that person. When I saw it, it was as if the person sent me $1 million. It means that you guys are appreciative of what we are doing. I know somebody will call the high chief one day to say, tell doctor of farm or Coach Samson to send their dollar accounts. Because in this platform, we don't talk naira accounts, dollar accounts. So let's continue. Let's look at the different types of ulcerative colitis. Let's look at the different types. We had mentioned them earlier, so we are going to zoom into them now properly. Earlier, I told you that we have about 5 major types. Number 1, proctitis. That's number 1. The second one is proctosigmoiditis. Number 3, distal colitis. Number 4, extensive colitis. and number 5, pancolitis. So let's look at each one of them. What do they mean? So this class will afford us that opportunity. Proctitis. Proctitis is an inflammation of the lining of the rectum. Now, let's look at the diagram in front of us. The diagram will explain it all. Just like I said in my opening, I said ulcerative colitis normally starts from the anus. It starts from the anus and it begins to go through the descending colon. So it climbs from the anus. It does not start from the ascending colon. Rather, it starts from the anus and begins to move upward through the descending colon. So the first type we are looking at here is an inflammation around your rectum, just around your anus. The next section, just after your anus, the next part upward is the rectum, where those muscles compress feces out to come out of your anus. So once that place becomes inflamed, and ulcers begin to develop around that region, we kind of, through medical examination, might be looking at the first stage of ulcerative colitis, which is proctitis, which is what? Proctitis. Now, this particular type of inflammation can come as a result of STIs, that's sexually transmitted infections like chlamydia, gonorrhea, syphilis, you name them, especially with people who engage in anal intercourse, the homosexuals, those who engage in anal intercourse. So this kind of UC can occur with them. Another reasons why this particular first stage UC can take place is inflammatory bowel disease. This one is very common, especially those with Crohn's disease. We might do this as a topic some other time. Now, they can be a predisposing factor for the emergence of proctitis. Then those who have exposed themselves to radiation therapy, especially in the course of they are taking therapy for cancers. Now, proctitis can be one of the side effects. It can just emerge as a result of you treating for a different condition like cancer. Then other reasons why this condition can emerge in your anus is as a result of either trauma, chemical irritants from foods, and other kind of medical procedures that may have taken place. So just like I said, some of these chemical irritants that are coming from food could be as a result of the kind of diet they take. And that is why we are imploring all those who listen to us to ensure they do not live the African diet well, because the African diet protects a lot. Let's look at the second one, proctosigmoiditis. Just like the name suggests, it goes beyond the anal region to the sigmoid region. And that is why it is having this name. So if you look at the first one, proctitis, we were looking at the inflammation around the rectum. And for this particular second one, the inflammation has gone above the rectum to the sigmoid section of the colon. So if you look at the diagram before you, you are going to see clearly how this inflammation tends to move upwards through the descending colon. It is moving upward from the anus through the descending colon. Now, if you look at the colored part of my diagram, you are going to see clearly how it is climbing up. So it is affecting not just the anal region, it is equally affecting the sigmoid colon, the sigmoid section of the colon. So, and most times patients with this proctosigmoiditis tend to complain about abdominal pains, abdominal cramps. Then you see them when they stool, you find blood in their stool, especially when they have diarrhea. And you find them even running to the toilet, even when their tummy is empty, body and nothing is coming out. They are unable to deliver anything. So these are some of the signs and symptoms that are associated with this particular condition. Then you find them having weight loss, loss of appetite, and constantly complaining of fatigue. So this is another sign. As you are listening to me, you may not know which stage you have, but please just follow my drift. At the end of the day, my brother Fanchilaka will be telling you what and what you need to do once you suspect that you have any of this condition. And Coach Samson will be coming to wrap it up to tell you there's no need for you to be afraid. Why? Because you are well guarded by men and you are well guarded by a product, the Super Life product, that can make you feel comfortable at home, regardless of the challenge we now see around our globe. Let's look at the third one, distal colitis. Now, if you look at the diagram in front of us again, the previous diagram, let's look at it closely. You can see how the inflammation, where the inflammation has gotten to. Now, look at the next diagram and see where the inflammation has reached. So you can see the entire descending colon has been taken over by the inflammation. The entire descending colon has been taken over. So we refer to this particular UC as a left-sided colitis. That's another name for distal colitis. Why? Because the entire descending colon has been inflamed, they have been attacked. They've all been attacked. So some of the signs and symptoms with this again is similar with the last one, which is bloody diarrhea, abdominal pain, frequent bowel movement. Now, just like I told you in my opening, autoimmunity is the major culprit in this particular one. Autoimmunity leading to all manner of ulcers appearing around the descending colon through the sigmoid region down to your anus, to the rectum of your anus. So a person definitely with this particular condition, there's no way this person will ever feel comfortable with the kind of ulcers that have taken over the entire descending colon. This same patient will still feel like going to use the restroom even when there's nothing in the tummy. The person goes and comes empty, not being able to deliver anything at all. So these are some of the signs that are associated with this particular type of colitis, distal colitis or left-sided colitis. I'm sure you are all following me. Let me pause to find out. Hello, hope you are all following me loud and clear.
Yes. Just always ask us to say yes on the chat room, on chat box.
Okay. Just saying yes to the chat.
Thank you.
Yeah, thank you very much.
Yes.
Yeah. Now let's look at the next one, the extensive colitis. Extensive colitis. Now, if you look at the name extensive, I want all of you looking at my diagram to look at the fourth diagram in front of you. We have talked about the first, second, and third. Just look at the fourth diagram down to your left. You are going to see extensive colitis. Extensive colitis has gone beyond your rectum. It has gone beyond the sigmoid colon. It has gone beyond the descending colon. Now it has gone almost reaching the ascending colon. So you can see how extensive colitis is. It has taken entirely 70 to 80% of your large intestine, making them inflamed, filled with ulcers. You can imagine what a patient with this kind of condition will be going through. Bloody diarrhea will increase. Why? Because the ulcers around this region have increased. The pains will increase, loss of appetite. The weight loss will be massive. Why? Because more than 70 to 80% of the entire large intestine have become inflamed. Let's look at the last one, which is pancolitis. Pancolitis, if we go back to our diagram, you can see the last diagram there. That means your entire large intestine have been taken over by inflammation. The ascending colon down to the descending colon to the sigmoid down to your rectum and anus have been taken over. The pain here will definitely be massive. In fact, patients with pancolitis stand the risk of even having cancer of the colon cancer. So it is not a disease condition that we should play or toil around with, because the patient at this point is going through problems. Apart from that, the patient would still be going through other pains like joint pains, eye problems, fatigue, weight loss, synonymous with UC, that's ulcerative colitis. The person will equally be having fever, night sweat, and restlessness. So autoimmunity is the culprit here. Genetic, the genes to transmitted from parents to offsprings equally a culprit. So a lot of these have played a significant role in the different types of UC that we are seeing today. Now, let's look at some of the general symptoms associated, even though I have mentioned them. Let's just go through some of them again. Number one, diarrhea, mostly bloody. When you come to the lab and we do a stool analysis and we see if the doctor is suspecting UC, ulcerative colitis, one of the laboratory reports he hopes to see from the stool analysis is the presence of red blood cells. So once we find red blood cells in your stool, then during stool analysis, we're going to equally inform the medical doctor that the stool is a diarrhea stool, because there's need for the doctor to know the type of stool. So, so blood is seen. Another thing is persistent bowel movements associated with this condition. Tenesmus, feeling you want to go and poo-poo, yet nothing is coming out. Cramping in the abdominal weight loss, nausea, fever, so many other things, joint pains, eye pain, and many other. So once now, what I'm saying, yes, I'm trying to get farm on board until
Yeah, I think he said they have a poor network in their end.
it's okay. Let me rush through the diagnosis and test. Now, please, I want to all of you listening to me that once you have any of these signs and symptoms, we will kindly advise that you see your healthcare provider. Don't assume that it is UC or ulcerative. As you're listening to me, some of you that are having some of this pain, don't begin to associate the pain that maybe you are having one of these. And you are seeing conclude conclusion. So there's strong need for you to see your medical provider. Please, once you see, the first thing that will be requested is blood test. There's need for blood tests to be done. And one of the things to do when checking your blood is to check if your blood level has gone. Cell volume will be checked to check for signs of anemia. And once this is checked and it falls below the threshold, the normal range for men or the normal range for female, the doctor will equally request that you do a stool test. As so when a macroscopy is done, the medical lab scientist the facial nature of and take it a copy, they able to establish fully the presence of RBCs. And once that need for parasites to be checked. In the course of my lecture, I told you that microbiomes within your large you now begin to have other organisms that are not meant to be in that place. Suggestive that there might be serious. Now, they may do so many other tests, substantiate their findings. Either an imaging test will be done, and they have several ways of carrying this analyzing all manner of medical X-rays using barium enema, or a CT scan, that's computed tomography scan, will either be done in order to cut your large intestine, or an MRI, that's magnetic resonance imaging, can equally be done. So it depends on the medical facility you've gone to. They might use what they want. Some might just do an endoscopy in your colon by doing procedure called colonoscopy or sigmoscopy. So each one of these is just to look at your colon to see, to either check for the presence of colon that has been attacked. So these are some of the tests that the doctor will have to carry out. Now, one interesting thing about oral medications, pathetic thing is that most of them come with severe side effects. They come with other complications. To be candid, when you read the leaflets for the drugs that are often administered for ulcerative colitis, if you look at the side effects, they are nothing to write home about. You care. And that is why, because we had told you earlier that the disease is an autoimmune disease, autoimmune is the major culprit. Since it is autoimmunity, it definitely means that we are now having cells that are going out of proportion, misbehaving. And that becomes super life, becomes a beautiful turf for super life. Why? Because just like Coach will be explaining to us later, the super life products act on this area. It's cell to cell. Why? Because they are stem-based. They are plant stem-based. And because they are cell to cell, it helps eradicate. So I want to leave that section for Samson. Let me not take section away from him. I want him to come and do justice to that with respect to treatment. I might not be spending time here telling you of the minor use of corticosteroid drugs or immunosuppressants or biologic drugs. I do not want to spend on. We have all of the drugs in our pharmacy. Yes, but please, for some of you are on some of these drugs, please take your time and read the side effects. They are not pleasant at all. So at this juncture, please permit me to invite Coach Samson to do justice to some of the Super Life products that can be used to handle ulcerative colitis. Once again, thank you for giving me this wonderful opportunity on this beautiful Good Friday. Coach Samson, are you there?
Wow, Doc, thank you. Thank you. Yeah, Samson, are you there, please?
Yes, sir.
Just you. Yeah.
Okay, good evening, everyone. We talk about that in doing, okay, exposing us to all these maybe having the knowledge, the deep knowledge of all these, and because some of us might look at it, what is the essence of this academic exercise we're doing every weekend? Is to expose us to knowledge of our health. Because in Super Life, we are not just a company selling or supplementary health products, that's the meaning of super life. We want you to live a life that is super. And one of the paramount thing is super life. You don't have to follow the prefer is better here. So in super life, in order for us to pick ourselves life-threatening health challenges, we are giving you a lot of information for you to know so that you can be the best doctor of yourself. Like I taught some people, like I on the in the office, I said, you are the first doctor of yourself. Don't have to be a reactive person or the reactive measures. So you need to prevent. And by way of prevention, is by having the knowledge of who is this person united. Please mute your something or we remove you. So by the way of
Your voice is going back. Something your voice is echoing back. Something your voice is back. Something your voice is echoing
okay.
back. Something your voice is echoing back. Something your voice is echoing back.
Hello?
Yeah, go
Hello?
ahead.
Okay, yeah. So what I'm saying, the best way to go process of to educate us about how we can prevent ourselves and loved ones from all the health menace that is really threatening the existence of a lot of us. So, like I say, Super Life has provides solution to many health challenges, even those one that the medical practitioner or medical world, the allopathic medicine, as terms as incurable. That is, they has no cure. You have to live with it for the rest of your so that you have to live with it for the rest of your life. So in our case, so we have a powerful two products that can actually help you to really solve any problem that has to do with ulcerative colitis or any Crohn diseases, because there are many other diseases that have to do with your gut, because this is a problem of gut inflammation. So Super Life Colon Care is a wonderful product that's been specially prepared or specially formulated to handle any problem that has to do with Crohn diseases or any gut issues. Your gut, that is your GIT, your gastrointestinal tract. So then this product is formulated with powerful 13 ingredients that can actually and help you to solve any problem of ulcerative colitis or any kind of Crohn diseases, even constipation, digestion, colon cancer, ulcer, and ulcer, any type of ulcer, any kind of gut inflammation. So they are formulated with a lot of probiotics. These probiotics are one of the powerful ingredients that helps the colon, particularly your gut, to be healed These are the ingredients, these are the device that the body needs for healings or rejuvenations or for repair system. So I want to say today that for those that might be having any kind of these challenges we have treated tonight, I want to say congratulations to you that because there's no need for panic, no cause for alarm. We have a product that can actually take care of this problem, and you will be free from these challenges. So also, when we look at it, we have SCC30, which are flashy products, a stem cell-based product that can also help you in solving this problem. Why do I say? Because when you look at most of these problems that was the one we treated today, in some cases even majorly medically after giving drugs, it might be a lot of no enough adequate improvement. Some people resorted to surgery, and this is can lead to a lot of complications. So, but with our products, there's no need for any surgery that might lead to any complications or lead to a death. So, that's why SC30, like doctors have just explained, that is an inflammation of your intestine, your through your gut, and it causes ulcer. This ulcer is like a wound. There's a wound there, and because of the peculiarity of the area affected, it is very, very difficult, to really handle. And most times, a lot of people die at the cost of these challenges. So, with S30 being a stem cell product, has ability to repair the damaged cells, because what really leads to that problem is because of particular area of that in your gut. The damage due to so many factors. The doctor has explained. Some are age, some are genetic factors, and some are autoimmune. The one that is caused, one of the risk factors, the autoimmune diseases, is a very complex, challenges, because this is in an area where your immune cells or your cells are attacking each other, and most times this problem it's very difficult to handle, because we might not be able to handle this case, because in this wise it is your body that is fighting against each other. So, but because of the technology behind our stem cell product SC30, the ability to go into your cells, into your bone marrow through the cell, and able to correct these abnormalities that is causing your body cells to attack each other. So that's why our product SC30 and SCC Plus is the best combination to treat any ulcerative colitis or any Crohn's diseases, or any kind of ulcer, or any kind of gut infections, or any kind of constipation, digestion, and any challenges that has to do with colon generally. So, with the help of SCT, that is the abnormal in those cells that is causing the autoimmune challenges, can address to the cellular level, and this will normalize, and it can solve this problem. This is due to the autoimmune factors, and even if it is due to the age, it can rejuvenate the cells. The cells can be rejuvenated, and that means the cells become new. It can repair damaged one, it can rejuvenate the cells, and it can even regenerate a new cells in the body. Even in the case of genetic issues, we know the genetic issues is the offspring, or that means it is through the bloodline, and the only way you can actually address things like this, because unless we can able to disrupt the genes from the cellular level, that means that even if you add this problem to the genetic factor from your parents,
there's every tendency, if you use our product S30 with the colon care, you can address this problem that your genes, your own genes will not carry the same problem into your string. And this problem of genetic issues can be altered from your own lineage, and you will be free from these challenges. So what are we saying? We saying this is not because we are just trying to tell you to come and get our product, because we know our product, as the doctor has explained to us medically, all the medical factors and diagnosis and everything and about these challenges. Our product also goes through the normal, scientific and the clinical processes before it is being adopted or being approved to treat any kind of medical challenges. And so we have, testimonies around the world because of the efficacy of this product. And if you look at it, why it's a bit better or advisable to use our, because it's natural. Any complication, like the doctor was saying the other time, those that lead challenges might due to even a drug, maybe some usage of some drugs, but because some of the we use, some of the allopathic medical drugs are side effects, and this side effect can also lead to some other medical challenges, like even the one we treated tonight. So in case of our product does not have any side effect. It's 100% organic, and it's not going to lead you to any further challenges in the future, but we give you the exact solution to that medical challenges you are suffering now, and you free forever. So we have, because of our time, I won't go further. But when we look at, for those you want to know more about our product, Life Colon Care SC Plus, like I told you, it has about 13 different ingredients, and look at those ingredients, those vitals. They have ability to work on your colon. Some of them, they remove impurity from your colon, and they are good for healthy colon. So in case you can use it as a way of preventing or not to fall into this category of people that are suffering from ulcerative colitis, or also if you have anyone that is already suffering from the problem, it can help you to solve the problem and they become. And also, when you look at our SC30, it is formulated with a powerful 9 powerful ingredients that has ability, to rejuvenate and also anti-inflammatory. Like one of the, the causes of the, ulcerative colitis is we call it inflammations of the gut. So our product is anti-inflammatory. That is, it can prevent you from, falling into this category. And if you find yourself in this category, you can also resolve the issue. So the product is only good for those that are already suffering from ulcerative colitis. It's also good for those that want to prevent themselves from being part of people suffering from this problem. So you can start both the preventive measures and the curative measures without any side effects, and you'll be free from any kind of Crohn's disease, colitis, or ulcer, constipations, indigestions, and also because of one of the ingredients inside SC Plus, which is called Sinetro, can also help those that is obese, that has that is very obese or has suffering from obesity or overweight, to lose weight, because we brought from Sinetro, which helps to remove the adipocyte, regulate the test of the adipocyte that control the actions of unwanted cholesterol in your system. Because of our time, I want to pause here.
Thank you. Thank you for really giving hope to as many that are already having this health. Quite sure the third way, the Esterotech, we are going to dive into that, but for the fact that Dr. Chooks is not here, but please, I want to use this opportunity to invite us, let us know, flyer have started going on concerning Dr. Chooks visiting us here in Lagos State in our office. And it's primarily on that new device of Esterotech. That is the new quantum device that has really complements what our ecosystem is doing. The combo system we are talking about, STC30, SCC Plus, SIC, SNC, and so on and so forth. This device has really come to really complement the holistic restoration of our health from any health challenges. So please, even if you are not in Lagos, you have any of your loved ones residing in Lagos, please take the address of our office and ask them to be there on the 29th. On 29th, I know that open our doors for as many that want to come and have a test of this Esterotech. Just being under that device for 45 days this afternoon has given me a very wonderful revitalization of my health. So, you know, what the Super Life is teaching is optimal health. We cannot stop until we ensure that everyone who are closer to our system, you have your optimal health. That is to say, you're on a preventive side, that you have adopted the preventive measure concerning your health. It is when that's been settled, that is whereby your people around you, your immediate family members, can now contact this one on the preventive side. Popular saying that always a slogan that says that prevention is better than cure. But no system has an opportunity to experience it until now that we have Super Life. And until now that we began this campaign since September 2024. And that campaign was launched by Super Life Revolution Movement, headed with this wonderful workshop by Dr. Rolf Ebe. He is the one that championed it. He is the one that has upholding it with other medical experts like Dr. Chooks and the pharmacist Chinaka, Dr. Muyuwa and co. So please don't take this moment for granted. That it is meant free does not mean that it is not of it, and come and get this valuable information concerning your health. So please, like I said again, it started today, being Good Friday. That's part of our Good Friday. Our office has been open for as many that want to come and experience this new device. So please come, it's free of charge. Well, come and give your health a pep, a very wonderful revitalization just by using the Esterotech. For just 30 minutes, you will become a new man. So come and experience it. We're still going to open tomorrow. Only on Sunday, we are not going to open. By Monday, we are going to open, and so till 29th and 30th. That is to say, till the end of this, begin today till the end of the month. So let all road leads to our office at number 3 Tunde Gafar Close by Aromire Junction off Adeni Jones, Ikeja, Lagos. So it's free of charge. We open by 9 a.m. Because of the tomorrow and Monday, we are going to close early, like 2 p.m. But from Wednesday, we are going to close by 5 p.m. as usual. So please come and take advantage of this moment, this period. And we are saying, we want to use it to say Happy Easter. Come with your family members. Don't come alone. Don't be selfish. So please come. And I can assure you that once you come, we are going to even add put the icing on the cake. We are going to serve you our coffee, our super coffee. Take up and know that they are beef. This is a 5-star that has to do whether you are old or young, you are giving birth, you have finished birth, you have entered, please come and begin a new life. So these are the things I want us to know, having at the back of our mind at this festive period, holidays. Come and take advantage of it. Dr. Chus, please, is coming to do more justice to that device. It's a powerful game changer in our ecosystem. So having said that, please, if you have any question, go to the chat room and drop your question. I want to let you know, haven't heard about this wonderful company, Super Life, and what we have to offer. Please, if you want to be part of us, which we will be delighted to use it on the IN or voters. Major reason to identify with us is that we don't want you to fall a victim of those that are patronizing or parading fake products out there. They have been complicating people's health issue. So please identify the company by registering with us so that you will be getting your product directly with the company. And any representing it at the company's discounted price. There are many more other incentives that you are going to have by identifying with the company. So please don't fall in that are parading fake products. Some of Nigerians went out of their way to import fake products into the country. And they used some pharmaceutical stores as a dumping ground. And if you happen to go to any pharmacy around you where you used to buy drugs, and you see what looks like Super Life products, I can assure you that is a fake product. I can guarantee you that. So we have put our satellites in place. So please, in order not to fall a victim, make sure you get your product from the genuine source. We don't have any relationship with any pharmaceutical stores. And that was what made us, last year, we went to have a very mega event at Radisson Blue at Isaac John Ikeja, Lagos, where we invited all the media houses, good number of them, and they came and be part of the event. If you could go to Punch newspaper on the 13th of September, 2024, you will see about here and you will see about the event and our disclaimer in that very wonderful day. So please be guided. So once you come and identify with your valid ID card and their email address, you will be connected to the company. You will begin to receive correspondence from the company. You want to order, you order from the back end of your database. Just send vouchers to our office. The dispatch rider will deliver to your address if you are within Lagos. If you are outside Lagos, we have an MOU with GIG Logistics. They will deliver to you in any locality where you are within Nigeria. If you are outside Nigeria, we have MOU with DHL. They will deliver to your doorpost. Please, all this is to ensure that you are accessing the genuine product that will give value to your health or to the health of your loved ones. Time might not permit for us to begin to go into the packages, but please, once you are ready, we are going to forward you the packages. You just pick the one that you are comfortable with. Then I've said at the beginning of the meeting that we have international trip, which is commencing on the 2nd of May. And we are heading to Malaysia. All road leads to Malaysia, to all our leaders, able leaders worldwide. By peradventure, you are not up to this particular trip. Please come closer to us so that we'll prepare you for the next one, which is going to be in July. And that July is going to be Thailand, which is Bangkok. Please be closer to your team, to us, wherever you are within the country. Then after that, the last for the year is going to be in November, which is Istanbul, that's Turkey. So please, we have a lot. While our health is being guaranteed, the wealth is guaranteed, even the lifestyle. So thank you very much. And once again, happy Good Friday and happy Easter in advance. Samson, I don't know whether there is any question in the chat room. Any question? Coach Samson. Hello.
No, there's no question.
Okay. Please, in absence of no any question, can we just unmute our mic, even as we share the grace in fellowship? Yeah, 1 to go. May the grace of our Lord Jesus Christ, the love of God, and the
and
sweet
the sweet
fellowship of the
fellowship
Holy
of Holy
Spirit
Spirit
be and
rest and
abide
abide
with us
with us
now
now
and
and
forevermore.
forever.
Surely God's
God's
goodness and
goodness and
mercy shall
mercy
follow us
follow us
all the
all
days
the
of our
days
Our
life,
of
life
our life,
shall dwell
and
in the
we
house
shall
of
dwell
of our
in the
and
life.
house
the
of the
house of
Lord
We
the
shall
Lord
dwell in the house of the
forever
Lord,
and
forever.
ever.
in the house of the
Amen.
Lord forever
Can we
and
personalize
amen.
it? Surely God's goodness and mercy shall follow me all
All
the
the
days of
days
my
of
life,
my life,
and I
and
will
I
dwell
shall
in the house
live
of the Lord forever
forever
and
and ever.
ever. Amen.
Amen.
Good
Forever
night.
and amen.
That's life is super. Life is super.
Night all. Life is super.
Hallelujah. Life is super.
Super.
Life is super.
Life is super. This is the old one. This too looks like the old one. Let me joke come again. Put my name there.